So hello, everybody. Good evening and welcome to Maine Public Health Association's Policymaker Town Hall about tobacco use and COVID-19. I want to thank you all very much for joining us this evening. I know it's a very busy time and I appreciate your time and your presence here. I also want to wish a happy Hanukkah to those who are with us that are celebrating Hanukkah today. My name is Becca Bolas and I'm Executive Director of Maine Public Health Association. And I am just again very excited to welcome you to our panel presentation. MPHA is holding this town hall because tobacco use in Maine is a serious problem, and that's particularly true among Maine youth. Data suggests that smoking can also increase your risk for COVID-19, and you'll hear more about that shortly from Dr. Colby Wyatt. Data show that in Maine, smoking is estimated to cost $811 million in direct healthcare expenditures, including $261 million in Medicaid costs and an additional $647 million in productivity losses every year. Each year, 2,400 Maine people die from tobacco-related illness, and the tobacco industry spends $45 million to market their products and addict their next generation of youth. We know that tobacco use is a pediatric epidemic, and if youth don't start using before the age of 21, they're unlikely to ever use tobacco products. So preventing them from using tobacco in the first place is incredibly important. That's why we're here tonight to learn more about investment efforts that are happening in Maine schools and Maine communities. We're also here tonight because racism is a public health crisis, and we need to take action to address the systems that perpetuate health inequities. Black or African-American Mainers comprise 18% of cumulative COVID-19 cases, while representing less than 2% of our state's population. We see disparities in tobacco use among racial and ethnic minorities as well, with smoking rates among American Indian and Hispanic adults that are greater than among white adults in Maine, 28.7%, 26.9%, and 17.6% respectively. Tonight, you will hear from a public health physician, from public health educators and advocates about the health implications of tobacco use and COVID-19, what is happening in Maine communities and Maine schools, and potential policy actions we can take to address these concurrent public health challenges. Before we get started, I want to acknowledge the support of Maine Cancer Foundation, which is making this educational opportunity possible. I want to go over quickly the agenda for this evening. After you hear from me, we'll open it up to our panel presenters. First, we'll hear from Dr. Colby Wyatt, who's a pediatric pulmonologist, to talk about the epidemic of teen vaping and the COVID-19 pandemic. And then we'll hear about the community perspective from Emily Dooling Hamilton, who is a tobacco prevention specialist at Healthy Androscoggin. Then we'll hear about the school perspective and community perspective from Lisa Dunning, who is a health educator, and Roxane Dubay, who is a health and wellness specialist at Bangor Public Health and Community Services. We'll hear about potential policy solutions from Lance Boucher, who is Senior Division Director of State Public Policy at American Lung Association. Lastly, Betsy Sweet, who is the founder of Moose Ridge Associates, will facilitate about 10 minutes of question and answer, and then we will wrap up this evening right around 5:45. And with that, I will turn it over to Dr. Colby Wyatt.
Sorry about that. I had to hit the unmute button. So thanks for inviting me to speak tonight. It's a pleasure to be here. Should I just say next slide, Becca? So next slide. I'll be talking about teen vaping and the COVID pandemic. And so one of the things to start with is a definition of vaping. And so for those of you who don't know, it's an electronic nicotine delivery system. The user inhales mist or vapor, and in that vapor, it contains several chemicals, including propylene glycol, vegetable glycerin, some sort of food flavoring designed for ingestion, not inhalation, and nicotine. The pod-based units that became very popular among teens, mainly in the form of Juul, also contain a nicotine salt that's proprietary and has a faster neural delivery. Users of this product call it a better hit, and that's part of the reason they seek it out. Each pod also contains approximately 40 milligrams of nicotine, which is about a pack of cigarettes. It's actually a bit more. Next slide. So what has the burden on Maine teens been for vaping and nicotine use? So to understand that, you have to understand where we came from. Our cigarette use peaked in 1998 with approximately 40% of Maine youth smoking. Um, there were various efforts, both public health policy from the state and national level, and also non-for-profit organizations working to decrease teen smoking, and it was by and large successful. In 2019, the estimated number of teen smoking was 6.8%. However, it's been rapidly replaced by vaping. Vaping usage in Maine and across the nation began accelerating in 2017 for various reasons. And the latest data we have is 2019. And at the end of 2019, the data suggests that approximately 30% of kids in high school were using current users of vape devices, regular users. And 45% of teen high school students had ever used. Hiding on that graphic on the right there is the middle school data. And it's somewhat shocking to find out that approximately 16% of middle school students have ever used a vape device. And that's where a lot of this is beginning. Next slide, please. So where are they getting their vape devices? The data available last year suggested they're getting it from other people. They're getting it from friends, borrowing it from friends, handing it off in bathrooms, and some of them were arranging to buy it through other people. Next slide, please. So all of that talk and thought about that was really present in our minds about 12 months ago, but it seems like ages ago. And that's largely due to our current COVID-19 pandemic. So that raises the question, what is the impact of COVID-19 been on teen vaping and nicotine use? The short answer is we don't really know, but I think you're going to be hearing from some of the other panelists on some information that we have. There've been various talks amongst my co-workers in the pediatric pulmonology world that it may be decreasing access because they're no longer around their friends as much to get the vape devices. However, we know that isolation, social isolation, specifically around COVID-19 and the information that teens are getting bombarded with has increased boredom from the isolation and also increased some anxiety for these teens, which may lead to increased nicotine use, and it's strongly associated with increased substance abuse in teens. Next slide, please. So a corollary to that question is, what is the impact of vaping on COVID-19? There has been some information recently to suggest that vaping increases susceptibility to infection, nicotine specifically in the vape. So COVID-19 enters cells through a protein on the surface of the cells called ACE2. And there were two papers this past summer that demonstrated that smokers have a higher concentration of ACE2 on the surface of their lungs. And when you remove those cells from the lungs and expose them to nicotine, the amount of ACE2 on the surface practically doubles when they're exposed to nicotine, therefore doubling the proteins that COVID uses to enter the cells. Next slide, please. And it can go further. So vaping may have an impact on how sick you get when you get COVID-19. There was an excellent review in pediatric cardiology recently that described the pathology of COVID-19, and it largely is related to vascular inflammation and blood clots. Acute respiratory distress syndrome, which I think everybody's heard, the ARDS that is popular in the news, that can be caused by blood clots in the lungs and vascular inflammation. It's largely where it's coming from. There are people walking around that are asymptomatic with low oxygen levels. That's a sign of a pulmonary embolus, and likely where a lot of this is coming from. There are ischemic strokes in 40-year-olds who don't have high risk factors that are infected with COVID-19. That's a blood clot. In this multi-system inflammatory syndrome in children that's been described is directly related to vascular injury and vascular inflammation and potentially blood clots. Next slide, please. It also turns out that when people were investigating the pathogenesis of vaping, when we were having vaping-associated lung injury, they found that vaping can increase your chance of clotting by activating this platelet activating factor. And that creates a possible scenario where two pro-blood clot processes are happening in a body, increasing your chances for having a life-threatening blood clot. Next slide, please. I should mention that that is a theoretical risk. There's no actual published data right now on the outcomes of people who vape and who get infected with COVID-19. So the summary of all of this is teen nicotine use has increased dramatically because of electronic nicotine delivery. Nicotine increases susceptibility to COVID-19 by increasing the presence of the COVID-19 receptor on the surface of cells in people's lungs. And both COVID-19 and vaping increase the risk of blood clot formation in experimental systems. And it's possible that this will increase it in users who get infected with COVID-19, but we don't have the data for that yet. Next slide, please. So thanks for your attention. I guess we're taking questions at the end. I know I went through a lot. That's about an hour's worth of information. There should be a handout supplied to you with references and also my contact information if there are any other questions. Thank you very much.
Thank you very much. Well, yes, just like Dr. Wyatt said, we'll be following up with everybody with a handout that goes into even more detail. And you're welcome to please use the chat feature to send any questions you have. And Betsy will be facilitating a Q&A at the end of tonight's talk. So with that, I will now turn it over to Emily. Welcome.
All right. Good evening. My name is Emily Dooling Hamilton. I work as a tobacco prevention specialist at Healthy Androscoggin. I've been working in tobacco prevention, education, and cessation for over 10 years now. Next slide, please. Healthy Androscoggin works in Androscoggin County to really create communities, a community of thriving residents by giving individuals the tools to live a healthy life. We really believe that a healthy community is a place to live, is a happy place to live. We serve all of Androscoggin County with the exception of Livermore and Livermore Falls, and our office is located right in downtown Lewiston. We have 5 main goals at Healthy Androscoggin: supporting physically active communities, promoting healthy eating, preventing substance misuse, supporting tobacco-free lifestyles, and preventing childhood lead poisoning. Healthy Androscoggin is a local tobacco prevention services contractor of the MaineHealth Centers of Tobacco Independence. That's a mouthful. This is part of the Maine Prevention Services. It's an initiative through the Maine Center of Disease Control and Prevention, working across the state to really impact tobacco, substance use, and obesity. And part of that is we're considered a district tobacco prevention partner, a DTPP. And we really work on preventing tobacco exposure, reducing exposure to secondhand smoke, and then also promote tobacco treatment. Next slide, please. At Healthy Androscoggin, we kind of have 3 main branches or avenues or veins that really allow us to educate the community about vaping. And again, through the Maine Prevention Services work, Healthy Androscoggin, and this looks at a date from October of 2019 to September of 2020, we had 20 educational opportunities that reached 6,575 youth and adults. And this was really included a various, whether it's in schools, in community, or through partner organizations. And through these educational opportunities, we always discuss vaping. Next slide, please. Additionally, we, again, through the work of the Centers for Tobacco Independence and MaineHealth initiative, we passed 17 tobacco-free policies affecting over 38,000 people. And this is settings that include multi-unit housing, youth serving entities, municipalities, public places, workplaces. And again, all of these policies that were passed included language that cover vaping devices. Next slide, please. Another avenue or branch at Healthy Androscoggin, along with St. Mary's and Central Maine Medical Centers, they developed a joint implementation plan to address youth vaping. The components include physician education, parent education, and youth involvement. And their community health boards, each hospital received education on youth vaping. Additionally, a coordinated education from the Centers for Tobacco Independence with physicians in both hospitals will take place in January. And lastly, youth volunteers at St. Mary's, as well as the Lewiston Youth Advisory Committee, are participating in a photo voice project, really exploring the risk and protective factors that affect youth vaping rates. And the photos will be showcased in early summer in both hospitals. Next slide, please. And lastly, that last avenue from the community perspective is we received a grant through the Maine Cancer Foundation, a tobacco prevention grant in 2018. And this allowed us to develop a mass reach health communication intervention really aimed at educating the community about the Tobacco 21 law that was enacted in 2018. It was a 2-year grant. It really allowed for prevention activities, education, and cessation support. And this really is all components of an evidence-based comprehensive tobacco plan, which included vaping education. Campaign materials were developed and to target adults and teens living in the community, to increase awareness and knowledge of Tobacco 21, and to also prevent youth from tobacco initiation. The campaign really connected community members with quick resources to increase tobacco cessation efforts. Next slide, please. So what we know is that nearly 90% of tobacco users, cigarette smokers, initiate before the age 18. 99 first try smoking before the age 26. And we know that the Surgeon General states that a mass reach communication, health communication interventions can be one of the most effective strategies when addressing smoking among youth. Next slide, please. So this was, again, a 2-year grant. So we had 2018 to 2019, that was kind of phase 1. We created materials to really increase awareness around the Tobacco 21 law and the tobacco cessation support among Maine residents. And again, that vaping information was in there in that phase 1. And the campaign focused on print materials and really digital advertising online. Next slide, please. And then phase 2, we really focused on social media platforms where teens are more likely to be reached, like TikTok, YouTube, Snapchat. Viewers were really driven to the Tobacco 21 landing page, which Becca will pull up on Healthy Androscoggin's website at the end, where they can get more information and more resources, again, around the law, but also really hitting on the vaping and vaping education. Next slide, please. We found some really great results from this campaign. We received over 11,000 views to that landing page that I spoke about, that Healthy Androscoggin Tobacco 21 landing page, again, with that great vaping and e-cigarette information there. And then also 200 million impressions on social media. We were blown away by that. We created not only a video, which Becca will show briefly, we created a GIF. We realized we did a very short video, but we learned that even that was too long. It was like a 30-second video was even too long. So we created GIFs. And that was what really hit home with those 200 impressions, and those included vaping information. So if Becca, if you would be willing to pull up that website and show those videos, that would be most appreciative.
Did you know teen tobacco use is on the rise? New devices like vapes are a growing threat to teens, masked behind appearances, smells, and tastes that do not resemble traditional tobacco products. As of 2018, tobacco sales to those under the age of 21 are now prohibited by law. Know the signs of use and talk to your teens about not using tobacco. Visit healthyandroscoggin.org/tobacco21 to learn more and how to quit.
And that video was really geared towards parents. And this next video that Becca will show is really geared towards youth and teens. Thank you.
Did you know 5.6 million young Americans are predicted to die from a tobacco-related illness? This is 1 in 13 people. In Maine, a person must be 21 or older to purchase tobacco and related products. Vaping causes users to breathe in harmful substances that can lead to cancer, heart disease, stroke, and a lifetime of addiction. Don't be a statistic. Visit healthyandroscoggin.org/tobacco21 to learn more and how to quit.
Great, thanks very much. And I'll turn it back over, and I'll look forward to questions at the end. Thanks for your time.
Thank you, Emily. Pull back up my PowerPoint here. Oh, I didn't show your gifts. Do that. Ooh. These are the two gifts that Emily was talking about. And anyway, I just want to make sure you saw those. And now I will turn it over to Lisa and Roxanne.
Thank you, Becca, and thank you all for being here this evening. I'd like to take a moment to introduce myself. I am actually a former Healthy Androscoggin person. I've been working in the world of prevention underneath. I did this for quite some time under the HMP umbrellas, and then came sort of out and did a little bit of different work. And then I came back to the world of public health, always underneath the health and wellness umbrella, however. And we too work as a district tobacco prevention partners out in the community underneath the same grant services that Emily spoke about. So I'm not going to go over all of that again. Roxane Dubay, my colleague at the Bangor Public Health and Community Services Department, is here with me this evening. You'll hear from Roxane shortly. We're here to share our perspectives with you regarding the tobacco landscape in our service area, which is Penobscot and Piscataquis counties. We support policy development, enforcement strategy development, education, and technical assistance, as well as, well, sometimes just an ear, across several areas in our communities, including hospitals, animal welfare organizations, multi-unit housing, healthcare, and so many more, including schools, all the way from the elementary to the college settings. And we're here today to share some of the experiences that we've had doing this work with our community partners. In fact, we could not do this work without building relationships and becoming trusted sources of pertinent information and true partners with our school communities. We're in frequent contact to share resources as well as to brainstorm solutions to pressing issues. Next, Roxanne has some great examples of recent concerns shared by one of our local school districts that we would like to share with you. Thanks, Roxanne.
Thank you, Lisa, and thank you again for sharing your time with us this evening. Last week, I spoke with an administrator from a large area high school in our service area. His observations reflect similar concerns shared by many school personnel in our area, as well as national research surrounding youth vaping. So I'd like to share 3 of his observations tonight. First, he shared with me that vaping seems to lack the stigma associated with cigarettes and other tobacco products. They are viewed as less harmful and are prolific in the high school. They are used by every student peer group. He shared that there's an equal percentage of vapors in every high school clique or group. So consequently, vaping's effects are showing up in every classroom, which means nicotine withdrawal is present in each and every classroom. Second, due to the high levels of nicotine in these products, youth are lured in by the friendly flavors, but hooked into dependence rapidly. He's heard from students, quote, "They tried it twice and they knew they were hooked," end quote. This too is in line with national experts. Lisa and I have had the privilege of hearing Dr. Nicholas Chatty, who is a pediatrician who specializes in adolescents in addiction medicine. And according to Dr. Chatty's research, nicotine dependence can occur with vaping as little as half a pod to 5 pods for adolescents. So what we think of as normal adolescent exploration can quickly become addiction and dependence because of the high potency of these products. Third, there's a social acceptance and a social nature associated with vaping. This results in kids sharing these devices. Kids will use a device offered from a friend, not even understanding or asking what's in it. Now, they're not only sharing nicotine and chemicals, but possibly a virus that could prohibit in-school learning for students, not to mention illness in school staff and students as well. Due to COVID-19, teachers have limited time to teach in person, which we probably agree is best for the majority of learners. Our partnership with our schools helps to chip away at the vaping obstacle showing up in each and every one of their classrooms, allowing schools to focus on the teaching and the learning, keeping schools open. More about how we support schools, I'll turn it back to Lisa Dunning.
Thanks, Roxanne. I know that's an awful lot to think about. But I'm going to just share that, like most of you, we've had to pivot the way that we engage within our work worlds now as well. Given the pandemic, this is true more than ever, especially with our school communities. And we're working to ensure that our resources meet our school partners where they're at, with student, parent, staff education, which of course is virtual now, and connecting with our schools to best practice prevention curriculum, and if necessary, teaching it for the schools who are lacking the capacity to do so themselves. We also support school boards through policy change, particularly in alternatives to suspension and connection to treatment. And to help with this comprehensive approach, we have developed a partnership agreement that can open the door for all of the school resources available through the Bangor Public Health and Community Services Department. This agreement serves as a template of options that schools can choose to request from the initial contact made by our staff. This streamlined approach has been a welcomed tool by school staff, given that our school partners reach out to us for a variety of assistance throughout the year. Now we have a more complete picture of the needs, and we're able to help them set themselves up and their students up for success at the beginning of our interactions together. So many of our school partners are stretched for time and resources, and they rely heavily on us to help support them in their efforts to do the hard work of providing safe spaces for children to learn in. If you know of a school that could benefit from a relationship like the ones we've described here, please do not hesitate to connect them to us, and we will ensure that they are put in contact with their local district tobacco prevention team. And we'd like to thank you so much for your time and the hard work that you do every day to ensure that Maine is as healthy as it is beautiful. Thank you.
Thank you. There's a little bit of excitement going on in the background at my house. My boyfriend just came home and the dog is excited. So just want to apologize for that and quickly transition to Lance is up next from the American Lung Association. And with that, Lance, I will turn it over to you.
Great. Thanks, Becca. Good evening, all, and glad to join you for this discussion. My name is Lance Boucher. I'm the Senior Division Director for State Public Policy at the American Lung Association. I'm based out of our Augusta, Maine office, temporarily in Manchester, Maine, since March, and oversee a 25-state region of state public policy for the Lung Association. Next slide. So as Dr. Wyatt mentioned, Maine has been a leader before in tobacco control, and every year the American Lung Association releases our State of Tobacco Control report card, and that's a summary of last year's grades where it looks pretty good. We've got 4 A's and a C in years past. In several of the other states I work in, it's a report card you would hide from your parents. So Maine has done good in smoke-free air protections. We have tremendous resources to help adults users quit with their tobacco helpline. We were a leader, the 3rd or 4th or 5th state to adopt Tobacco 21. So we've done some things right, and we know how to address the tobacco epidemic. Unfortunately, over the past decade or so, Maine's tobacco policies have lagged, and tobacco program investments were significantly reduced. And during that time of stagnation, the tobacco industry adapted, and they changed their products, and they used a lot of the same tactics, but they introduced e-cigarettes at the time when we were not funding the tobacco program at a high degree. And youth vaping has skyrocketed over those periods. In the last 3 years, 1 in 5 or 3.6 million of our nation's kids are currently using e-cigarettes. In 2019, 8,000 kids a day tried e-cigarettes. Maine, 45% of high school students have reported trying an e-cigarette, and almost 30% are regular users of these products. And while we made progress in decreasing combustible cigarette use, this has resulted in about 1/3 of our kids now using tobacco products. And without policy action and changes now, we are going to miss the opportunity to create the first tobacco-free generation. Next slide, please. So the American Lung Association has a number of policy priorities that we can put in place to both address the tobacco epidemic and the youth vape epidemic. And I love this slide that a colleague at the US CDC uses to discuss flavored tobacco products. And really, excuse me, advertising is rampant, and that's what leads the kids to water. The flavors is what makes them drink, and the nicotine keeps them coming back for more. 81% of kids have reported using, starting with a tobacco flavored product, and 90% of adults who use e-cigarettes also use flavors. So one of the first policies that we would our champion as a policy priority in 2021 is to completely remove the sale of all flavored tobacco products. This is e-cigarettes, this is flavored little cigars, menthol combustible cigarettes. All of these products are flavored to reduce the harshness of tobacco. They're attractive to kids, and they get kids hooked and get them to be the replacement tobacco users of the future. Next slide. Next slide, please. And this policy is starting to, back to the map, please, sorry. This policy has been enacted in California and Massachusetts, and there are a number of states that will be pursuing policies in 2021, and hopefully Maine will be one of them. This really started with a number of localities in California and Massachusetts, and has now moved into the state public policy realm. New York State is yellow, as was New Jersey on this map, because they have addressed only flavored e-cigarettes. We are looking to make sure that those exclusions just covering e-cigarettes are not part of a bill. We need a comprehensive proposal that addresses all flavored tobacco products. Next slide. The second policy that we are focusing on is tobacco taxes. Maine used to be a leader in New England with a high tax, and we know that price is the most effective way to prevent kids from using tobacco products, and also for adults to make a quit attempt. So it has been 15 years since Maine increased its tobacco tax on cigarettes. All the other states you can see have addressed it within the last 5 to 7 years. And where we used to be the highest, we are now the second lowest, just ahead of New Hampshire by less than a quarter. So we are long overdue for a tobacco tax increase on cigarettes. The public strongly supports increasing the price on tobacco products with a recent survey that we did with the Maine Public Health Association, especially if the revenue is used to help smokers quit and prevent youth from starting to use tobacco products. So with revenue from a tobacco tax increase, next slide, we would encourage and support full tobacco program funding. This chart is a little hard to read, but the US CDC every few years recommends a level that states need to fund their tobacco control program at to adequately address the epidemic. For Maine, it is $15.9 million. For a number of years, we have been falling way short. Over the last 7 or 8 years, we have drastically reduced our tobacco program funding. Fortunately, the legislature during the last budget cycle and the governor dramatically increased tobacco control funding and put us at about 80–85% of the US CDC recommended level. We need to make sure that that level of investment at a minimum continues, and really set a goal to get to a fully funded tobacco control program to have the projects and programs in place to prevent youth vaping and help adult users quit. Next slide. I think that's actually the end of the 3 policy priorities. So in 2021, the American Lung Association and our partners will be really looking to address those 3 things: a flavor ban, removing flavored tobacco products from the shelves, fully funding the tobacco control program, and increasing the price of tobacco products in the state.
Awesome. All right. Well, thank you, Lance. Thank you, everybody. We really appreciate this information, and we really want to respect the time of all the legislators who have joined us. And for those of you who had trouble getting on, we apologize for that. I know there were a few people who tried to get on and still working on it. So, but we already have a question. If you have a question, if you would just put it in the chat, and also I will get to it. But the first question that I saw was from Representative Patty Hymanson. Hi, Patty. Thank you. And that was, where are the kids getting this stuff? You know, if we pass Tobacco 21, you know, we're talking about middle school kids having access to this. Can any of you talk a little bit about access?
I'm happy to, or it was part of my talk. And then if other people have things to add. So early on, there were no restrictions on online purchasing. So they would just order it online. And it was middle school students, high school students, anybody could order it online. Those restrictions kicked in, and then you started having to have a birthday that was legitimate. So they still ordered it online with somebody else's birthday. And then restrictions got even greater. Now the latest data is they're getting it from their friends, and their friends are getting it from their friends or their family members. I had a patient I took care of in the ICU who got a vape pen for her birthday. She was 13. So they're getting it from all over. Mostly friends. It's not seen as a dangerous thing within the teen community, and I think within some families as well.
Okay, yeah, I think that's something that we hear all the time, is that, you know, kids don't think it's smoking. Vaping is not smoking. It's very different. That's what I hear all the time. But okay, we have a number of questions here. Let's get through them. Again, two for you, Colby, Dr. Wyatt. What's your experience with treating vaping nicotine addiction? And then, given the high level of nicotine in vaping, can you talk about the long-term effects of that nicotine use?
Yeah, absolutely. So I'm not an addiction specialist. I'm a pulmonologist. So my role in that is identifying people who are vaping and then getting them to resources that help them. I think the biggest thing that I tell families to do to help treat addiction in teens with vaping is talk to their teens. And teens include like 13, 12, and 11 years old. I know teens not on the end of it, but that's when it starts. Talk to your kids before you're comfortable doing it about vaping. Because if you're uncomfortable doing it, that's okay. Talk to them about vaping, talk about the risks of vaping. The best way to get them to not use it is to have it part of your conversation. And the second best way is to get them to quit is to talk about it. There are great quit lines available in Maine. There's a Maine quit line. I think there are resources through one of the panelists who spoke here. I can let them speak more about that. But that's kind of just one small part of my job. I'm treating the consequences of smoking, which is the second part of that question, I think. So nicotine is a vasoactive substance and is associated with vaso events, meaning strokes, heart attacks, things like that in the long run. And I think in the short term, what's showing up in schools and in mental health services and in pediatrician's office and in homes at the kitchen table is nicotine withdrawal. So one pod is 40 milligrams. The average pack of cigarettes is, I think, 36 milligrams of nicotine. Some kids are going through a pod and a half a day. That's a pack and a half smoker a day. And then they run out because they're not allowed to buy it. And then they are having anxiety attacks. They are having lack of concentration at school. They're getting angry. It's causing a lot of disruption in families and in classrooms. They're missing classes because they're going to the bathroom constantly to vape, not to use the bathroom. So that's kind of the short-term effects of it. The longer-term effects, my adult colleagues see, but it's mostly cardiovascular risk.
Yeah. Wow.
And that's not smoking, that's nicotine.
Yeah. Okay, great. Representative Grohowski has a question around the federal, what's happening on the federal level regarding flavored tobacco products. A lot of ups and downs of the feds during the last session, which led to some confusion and an action on the part of the state legislature. So the question was, do you think we'll see any national action under the Biden administration around flavored tobacco products? Anybody have anybody want to weigh in on that?
We are certainly at the Lung Association, our national partners are working. We've requested meetings with the transition team on tobacco. We hope to see a more aggressive action. However, the past two administrations on the feds, e-cigarettes came to rise under them, and we have been talking about removing these products from the market for that entire time. So we are hopeful for action, but if anything has shown us that state legislators are the ones who are leading the way on a lot of these issues and then cause the feds to act. So we are going to keep a 50-state strategy approach and really work in the Maine legislature and across the country to advance these policies and hope the feds catch up.
Great. Okay, I have a quick question, I think, from Allison, Representative Hepler, and then we have a couple that I'm going to bundle together. So Representative Hepler's question is, didn't the legislature last year increase the excise tax with the increase going to tobacco helpline and cessation programs?
The legislature increased the tax on, equalized the tax on OTP, other tobacco products, which e-cigarettes fall under that, as does little cigars and things that had a lower tax rate. And that tax revenue in the legislature dedicating that to the program was one of the ways that we saw that us really ramp up to 85% of US CDC recommended levels. So with the money in the budget and that equalization, is how we got the funding increase, but that rate is still low and equalized at $2 per pack of combustible products.
Great, okay. And Representative Michelle Meyer, hi, also is asking a question. Does anyone have any data on the California and Massachusetts flavor bans, and have they resulted in decreasing the number of kids vaping or increasing the number of kids seeking cessation?
Both of the, sorry to jump in again, both of the flavors in Massachusetts and California are just getting, I mean, California just went, is not implemented yet. Massachusetts just went into effect a short time ago. So we haven't had a long enough period to have data. We might start to get some anecdotal stuff the first part of the year that we can definitely start to share out. But California is being challenged right now, so not implemented.
Okay. So a couple of questions, including from Representative Pedworth. Hi, Representative Pedworth, thank you for joining, and a couple of other people, which are, why is it so hard to pass? I mean, these priorities seem so easy, and they seem like they're for public health, and it seems like it should be relatively simple for the legislature to take action on this stuff. And so the question is, what are the barriers? Why has it been challenging? Why is it challenging to raise the tax? Why is it challenging when we know that there's great data on the effect of tax and what happens with young people smoking and adults as well. But so anybody want to chime in on why it's so difficult and why we have such a hard time passing this stuff? Anybody want to take a stab?
Well-funded opposition. I mean, the tobacco, as Becca mentioned, the tobacco industry spends $45 million a year marketing their products in Maine. So when we're spending $1 for every 4 they spend just on marketing, and the same is with their efforts to defeat tax proposals. We've had the flavor discussion before in the legislature. Senator Millett graciously put that in and fought the battle, and the industry and the tobacco stores came out in full force, and it's a tough opposition. And I mean, we have the stats, we have the data that shows that the health savings that could be realized by reducing the tobacco burden in Maine. This year, hopefully we will have more partners involved to really go toe-to-toe with the industry and make the case and move these policies forward.
And I would be, totally out of character if I didn't also mention the whole money and politics connection, right? I mean, the tobacco industry not only does huge outreach and advertising to young people, but they also give a lot of money in elections. And so that has a big impact on what happens. So, all right, there's a question from Renee Page. Just talking a little bit, and I think this is a really important point and question that you raised, Renee, is that we are seeing a decline in Fund for Healthy Maine funding from the tobacco settlement because of a decline, somewhat of a decline in use of combustible tobacco and an increase in vaping products. And the vaping products are not included and don't trigger Maine tobacco settlement funds. So that's why I think this tax issue and raising taxes is going to be really important to keep that together. But does anybody want to mention that or talk about that more? Anybody have a thought on that? I mean, it's just sort of so the question is sort of the answer, right? we're going to have to really pay attention to that. So, okay. And then there's another question about would tobacco tax revenues end up supporting MaineCare and not a tobacco program? And what would happen with that? And again, just from the past, when we have worked on tobacco taxes, when we have made sure that they have dedicated at least a certain portion of the funds to go to tobacco treatment and education and prevention. So I'm hoping, I think the idea is, of course, that that will happen again. So yeah. But I don't know if anybody else wants to say anything about that.
The tax increase that we are proposing of a $2 increase in Maine's tobacco tax would bring in excess of $45 million. So there is ample revenue that could be used to support other health programs. Obviously, the proposals, the three priorities that we mentioned, are kind of linked together as a flavor. Removing flavored products has a cost. So tobacco tax increase can help fund the fiscal note to removing flavors, adequately fund the program, and also there is substantial revenue left over for continued investments in other health programs.
Awesome. Yep. So it looks like a win-win-win. So, and on that win-win-win note, I want to be very respectful of everyone's time because I know that legislators who were able to join us, thank you. It has just been amazing, and I know you're invited now. This is your life now. You're invited to all of these things since we can't come and corner you in the halls. So we are so grateful for you coming on. And Representative Sachs, thank you also very much. Newly elected representative from Freeport. It's great to have you. So, so thank you so much for being with us. You will see all of the panelists that you see here will be very involved in all of the legislation that's coming forward. You will hear about legislation. There's a number of things. Some of the legislators here are putting some of that legislation in, and others are, we're just learning about it. So we will be counting on you and working with you to get this information out, to pass these bills and make sure that your colleagues know about it. Rebecca from MPHA has recorded this session, and we're going to send out the link to legislators who wanted to be here but couldn't for one reason or another. So we will make sure that we get that information out to all of your colleagues, and so that you have it also in another a form that you can keep, because it's going to be really important, because you know, our kids are a really important link here. And you know, they're getting a lot of mixed messages from their peers, and you know, lots of and from the tobacco industry. So it's up to us to sort of put it forward. So thank you all. Thank you very, very much to Lisa and Lance and Emily and Colby and Roxanne and Becca for putting this all together and for your great information. I'm sure we're going to come back to you. And so you know, we will continue to be in touch with you. And again, thank you so much. We hope you have wonderful holidays and stay safe, and don't vape. So thank you. I don't know, Becca, is things quieted down? If you want to say anything, okay. She's got lots of Christmas tree noise in the back. So thank you all very much again, and we will be in touch. Alrighty, take good care.
Thank you.
Thank you.
Thank you.
Thank you.
Thanks, everybody.